I would like to talk about flow signals in polyps is a biomarker of early recurrence after combination therapy in polypoidal choroidal vasculopathy. I have no financial disclosure. Combination therapy with PDT and anti-VEGF agent resulted in greater polyp regression than the anti-VEGF monotherapy in eye with PCV. OCTA is a new non-invasive imaging technique that makes it possible to visualize blood flow and could be a useful tool for monitoring choroidal neovascularization non-invasively, including in eye with PCV. The purpose of this study was to evaluate blood flow within polypoidal lesion in eye with PCV after combination treatment with aflibercept and PDT, and to compare the presence of flow signal between non-recurrent eyes and refractory eyes. We performed a retrospective study of patients with PCV treated with the combination therapy of intravitreal aflibercept and PDT. A total of 46 patients who underwent combination therapy for PCV were followed for more than 6 months. The inclusion criteria was active PCV confirmed with ICGA and OCTA at baseline. Additional anti-VEGF injection was given as blolenata. According to the OCT finding after month 3, we defined an increase in any fluid after it had resolved as recurrence. We defined persistent exudative change at month 3 despite additional IVA as poor response. OCTA images were obtained by swept source OCTA. We evaluated the flow signal corresponding to each polypoidal lesion from the cross-sectional images on OCTA. We evaluated flow signal in all polyps at baseline, 2 weeks, and 3 and 6 months after treatment. If there was any polyp in which flow signal were detectable, we defined it as a visible case. In 44 eyes, the SRF resolved within 3 months and resolved at 4 months in 1 eye, and 1 eye had persistent fluid during follow-up. During the 6-month study period, 27 eyes showed no recurrence with no additional treatment. 70 eyes showed recurrence, and 2 eyes showed poor response. We compared the baseline characteristics between recurrence and refractory eyes. There was no significant differences between 2 groups. At baseline, polypoidal regions were visualized on OCTA in 44 eyes. Flow signal in the region were visible in the OCTA images in 11 eyes at 2 weeks, 25 eyes at 3 months, and 32 eyes at 6 months after combination therapy. On OCTA at 2 weeks after treatment, flow signal were detected in 3 of 27 eyes without recurrence, and in 8 of 19 eyes with refractory eyes. Detection of blood flow signal in polypoidal lesion at 2 weeks was associated with refractory eye. On OCTA at 6 months, flow signal were detected in 16 of 27 eyes without recurrence and in 16 of 19 eyes with refractory eyes. That was not significantly different. This is an eye with non-recurrent PCV. In this non-recurrent eye, flow signal in polypoidal region were undetectable at 2 weeks after treatment, but flow signals gradually recovered at 3 months and 6 months after treatment. This is the eye with poor response PCV. In this poor response eye, flow signal in the polypoidal lesion on OCTA persisted 2 weeks after treatment. Previous study reported that flow return in polypoidal region on OCTA images is not necessarily associated with recurrence. In our study, 59.3% in non-recurrent eye showed flow signal within lesion at 6 months after PDT. And another study reported low flow signal in polyps may indicate a good response after monotherapy for PCV. In our study, flow signal in polypoidal lesion at 2 weeks after treatment were associated with refractory eyes. In conclusion, blood flow signal in polypoidal lesion or OCTA after combination therapy might indicate ineffective treatment. Thank you.